is, by analysis that what is going wrong in the GT. Because until and unless you know your mistakes, you know your weaknesses, it's very difficult to pinpoint that where you can improve. So try to categorize, like I always say in the grand test, try to categorize whether it's the conceptual questions where you're making mistakes. Is it the memory-based questions where you're making mistakes, or is it just silly mistakes, like you knew the answer but somehow you did not mark it right? So try to categorize and see that which is that area where you need to work and accordingly work on that. If consistently there's some subject which is always in your like the bottom three, try to tackle that subject first before you give the next grand test, right? That should not be difficult to know for you as well, because you have a consolidated list of NF100 topics. A consolidated list of NF100 topics is available on Telegram. It will not be a difficult task. So, like I said, let's just first start with page number 200, vaginal infections, bacterial vaginosis, trichomonas, and candida. Alright, Pooja, the next NF100 topic that we would do, we'll try to do on monoclonal antibodies. I'm sorry, I forgot even about that. So, next NF100, I'll plan on monoclonal antibodies. Okay? Alright, so vaginal infections, bacterial, trichomonas, and candida. First, talking about some important features. Okay, so tell me that which of these infections does not have itch? Itching is absent in which of these? In which of these the itching is absent? Alright, let me just switch that off. Okay, so remember that it is bacterial vaginosis where the itching is absent. So imagine someone saying, fish. So someone is telling you, like, there's an argument going on between you and someone else, and your friend is saying, you fish, and you say, no bitch. Okay, so it is you fish and no bitch. Fish helps you to remember that this has fishy odor. No bitch is basically no itch, and B is bacterial vaginosis. So remember, fish and no bitch. That is fishy odor, and there is no itch in bacterial vaginosis. What do we see in bacterial vaginosis? So remember A, B, C. A, B, C is Amsel's criteria. Bacterial vaginosis, and it is clue cells are seen. Okay, Amsel's criteria is used for diagnosis of bacterial inflammatory cells. Clue bacterial, and B is bacterial vaginosis. So remember, fish and no bitch. That is fishy odor, and there is no itch in bacterial vaginosis. What do we see in bacterial vaginosis? So remember A, B, C. A, B, C is Amsel's criteria, bacterial vaginosis, and it is clue cells are seen. Okay, Amsel's criteria is used for diagnosis of bacterial vaginosis, and clue cells are seen in bacterial vaginosis. Are there any inflammatory cells in bacterial vaginosis? There are no inflammatory cells in bacterial vaginosis. The problem in bacterial vaginosis is that the normal bacterial flora is gone, and then the other bacteria basically growing. That is Gardnerella vaginalis. So it's a gram variable Coccobacilli, Gardnerella vaginalis. So there are no inflammatory cells. Remember that there are clue cells. There is no itching. There is fishy odor. Okay, there is fishy odor, which is seen with bacterial vaginosis. Which vaginal infection can occur in the acidic pH? Acidic, here by acidic we mean the pH is less than 4.5. So remember, candida is candid with acid. Okay, so the rhyming words, candid with acid. So candida is very candid with acid. It can play with the acid. So that means pH less than 4.5 will be seen with candida. The rest of the two are pH more than 4.5. Okay, pH more than 4.5. And the type of discharge, where do you see the strawberry cervix? Strawberry cervix is seen with which infection? Vaginal infection. So remember that strawberry is TR. It is trichomonas. Strawberry cervix is seen with trichomonas. So when we draw the strawberry head, and then we have the green leaf. So this is strawberry cervix, right? This is strawberry cervix, and this green leaf represents the green discharge. Okay, that represents the green discharge. Just give me a moment. Sorry, my bad. I was not audible. Okay. Yeah, so what we were talking about is trichomonas has green discharge. The green leaf represents the green discharge. The strawberry cervix, the TR helps you to remember it is trichomonas. Remember, the drug of choice is also metronidazole. We need to treat the partner as well because it's a sexually transmitted infection. So that is about trichomonas. And trichomonas, we have seen in the protozoa wala topic that it has flagella and it has this undulating membrane. I hope all of you remember that. It has this undulating membrane with the flagella. Okay. And what is this image showing? This image is showing the clue cells. Where do we see the clue cells? Bacterial vaginosis shows the clue cells, right? So we are seeing this cells attached. There are this is called as clue cells. Okay, that is clue cells, right? So sexual transmission present with trichomonas. Discharge in bacterial vaginosis. What discharge do we have? It's a thin yellow discharge. Trichomonas is green discharge. Candida is curdy, thick white curdy discharge. No itching, bitch, no bitch, bacterial vaginosis. pH less than 4.5 is Candida. Strawberry cervix is trichomonas. Whiff test positive, it can be in trichomonas and bacterial vaginosis both. Clue cells, ABC, bacterial vaginosis has clue cells. For bacterial vaginosis, here also we use metronidazole or we can use clindamycin. For trichomonas, it is clindamycin. For Candida, it is fluconazole, right? It's fluconazole antifungal that we need to use. Drug of choice for trichomonas in pregnancy also, it is metronidazole. Okay, even in pregnancy, it's metronidazole, which is the drug of choice. Okay. What is this image showing here? This image is showing this curdy discharge, the thick white curdy discharge that is seen with Candida. And what is this image showing? This is the strawberry cervix. Okay, this is the strawberry cervix. Strawberry cervix is trichomonas. Okay, strawberry cervix is trichomonas. So, is this clear with everyone? The topic of the vaginal infections. What are the key words? What are the differentiating features is what we need to know to differentiate one from the other. Right, so no bitch, that is no itch in bacterial vaginosis. Candida is curdy. Candid is candid with acid. That means pH less than 4.5. And yes, clindamycin given in bacterial vaginosis also. Trichomonas is metronidazole. My bad. I wrote clinda here, so this is my bad. Thank you for pointing that out. This is metronidazole. Okay, trichomonas is metro. ER is TR. It is metronidazole. Clinda is for bacterial vaginosis. So metronidazole or clindamycin. Okay. All right. So that was about the vaginal infections. Now going to the next one, the STIs, and then we would have the STI kits. Okay. So this is what page number? Page number 212. So this is page number 212. STIs, right? Very, very important topic. We will again try to remember the distinguishing features of each of them. So we have in the STIs, we have this syphilis, chancroid, LGV, granuloma inguinale, and then we have genital herpes. Do you remember which of these is called as donovenosis? कल देखा था हमने ovarian tumors में. Granny is dawn, right? So granuloma inguinale is also called as donovenosis. Okay, so remember that granny is dawn. So granuloma inguinale is donovenosis. Okay, that's donovenosis. Syphilis. What are the causative organisms? Syphilis is caused by Treponema pallidum. Okay, that is caused by Treponema pallidum. Chancroid. Chancroid is caused by Haemophilus ducreyi. Okay, so chancroid is Haemophilus ducreyi. LGV. What is the causative organism for LGV? It is a Chlamydia trachomatis L1, L2, L3. Remember L for L. That means L1, L2, L3. It is Chlamydia trachomatis L1, L2, L3. Granuloma inguinale, previously called as Calimatobacterium. Now it is called as Klebsiella granulomatis. Right, so granuloma is granulomatis, now called as Klebsiella. Herpes, genital herpes is HSV. The genital one, below, lower down is 2. Upar wala, HSV encephalitis is 1. Below the waist, it is HSV2. Right, so this is HSV1 and HSV2 is the genital herpes. Now talking about the important points of each one of these. So syphilis. Okay, remember that syphilis we said is caused by Treponema pallidum. The incubation period is longer, 9 to 90 days is the incubation period, right? The genital ulcer that we have in syphilis, remember S for S, it's a single ulcer, which is syphilis is painless. Okay, remember that syphilis is painless. Syphilis is painless. Okay, so painless single ulcer, also called as hard chancre. Okay, and what does it exudes on pressing? It exudes serum. So remember S for S, multiple S. So syphilis is single and it exudes serum. The other S is the lymph nodes that we see in syphilis. Those are shorty lymph nodes. Shorty lymph nodes are the chote discrete lymph nodes. They do not form the buboes, right? So they do not conglomerate and form the separative lesions. So it has shorty lymph nodes. So it's a single painless ulcer which exudes serum on pressing. There can be shorty lymph nodes. This is painless. Remember, syphilis is painless. Okay, very, very important. Syphilis is painless. Now, because it is caused by Treponema pallidum, which is a spirochete, right? So we use a dark field microscopy or a dark ground microscopy, helps us visualize Treponema pallidum. So what will you use? It is dark field microscopy, which is important here in syphilis. Okay, apart from that, we have the serological test as well. Like VDRL is a screening test. We have FTA, ABS, TPI test, right? There are other serological tests as well, which are available for syphilis. Now, what do we see? Syphilis is the one which has a lot of systemic involvement as well. So we have secondary syphilis, we have tertiary syphilis. Primary syphilis is where we have the genital ulcer. Secondary syphilis is the one which has the mucocutaneous involvement, right? So mucocutaneous mouth, it causes the mouth ulcers, right? It causes the mouth ulcers. S for S, remember it is snail track ulcers. It is called as snail track ulcers. Cutaneous involvement, remember secondary syphilis is an important cause of the lesions on palms and soles. These are coppery, okay? These are coppery lesions on the palms and soles. These could be all types of lesions. It could be macules, it could be papules, but these are never vesicles, okay? These are never vesicles. In which stage of syphilis do we see the vesicles? Vesicles are present in congenital syphilis, okay? Vesicles are present in congenital syphilis, right? So mucocutaneous involvement, along with that, there is alopecia as well, and we have condyloma lata, not condyloma acuminata. It is condyloma lata. Remember, lata are the flat lesions. Okay, these are the flat lesions. Condyloma acuminata. What is condyloma acuminata? Acuminata is basically warts, right, caused by HPV, human papilloma virus. So this is syphilis has condyloma lata, not condyloma acuminata. What lymph nodes do we have in syphilis? The important lymph nodes in syphilis, remember one important group of lymph nodes, it is epitrochlear lymph nodes, right? यहाँ पे अगर कभी lymph node mentioned है, we should always think about syphilis. The epitrochlear lymph node, we should think about syphilis. Okay? Then we have tertiary syphilis. Tertiary syphilis has gammas, the bony gammas, right? It has the CVS involvement, it has the CNS involvement. CVS involvement, what part of aorta is involved by syphilis frequently? It is the ascending aorta. Okay, that's the ascending aorta. It can lead to the dilatation. It can lead to aortic regurgitation. The appearance of the aorta is called as tree bark appearance. Okay, that is called as tree bark appearance. Now, in the CNS, what do we have in the CNS? It is tabes dorsalis, right? Tabes dorsalis, as the term says dorsalis, the involvement of the dorsal columns. Okay, the involvement of the dorsal columns. What sensation is carried by dorsal columns? The vibration, proprioception, fine touch, right? So there would be loss of this. Plus, which vitamin deficiency we have seen involves the dorsal columns? Vitamin B12. Similar to that, we have vitamin E as well, right? But the difference here is in tabes dorsalis, there will be the Argyll-Robertson pupil as well, right? There is Argyll-Robertson pupil, which is seen in tertiary stage of syphilis. Okay, when accommodation reflex is present, the light reflex is absent. The Argyll-Robertson pupil is also present, right? So that is about the tertiary syphilis. Now, what is generally the drug of choice in syphilis? It is benzathine penicillin. Okay, it is benzathine penicillin, which is the drug of choice, and except in neurosyphilis. Okay, except in neurosyphilis, where because benzathine penicillin does not cross the blood-brain barrier, so we give crystalline penicillin. The aqueous crystalline penicillin is what we give because it crosses the blood-brain barrier. Right, this is a recent year question, right? I'll write it as RYQ. So remember that crystalline penicillin is the one which is the drug of choice for neurosyphilis because it crosses the blood-brain barrier. This is given as IV, right? IV crystalline penicillin given for 14 days. Okay, this is given for 14 days. Benzathine penicillin is given as 1 dose or 3 doses weekly, depending on whether it's an early syphilis or it's a late syphilis. Right, so benzathine penicillin. We will see in the STI kits if the patient is allergic to penicillin, right? Benzathine penicillin का allergy है. तो फिर हम कौन सा drug देंगे? Then in that cases we can give doxycycline. Okay, so that is doxycycline can be given if the patient is allergic to penicillin. Right. So that is all about the syphilis. Now talking about the next one, that is chancroid. Right. Talking about chancroid. So chancroid is Haemophilus do cry, and a chancroid is Haemophilus do cry. Do cry. Patients do cry because of the pain. Right. So remember that syphilis is painless. Chancroid is painful. Okay, there is painful ulcer, there is painful lymph nodes forming the buboes, right? So remember, this is one of the conditions which can form the buboes. What are buboes? Buboes are nothing but the lymph nodes which have now undergone separation, right? So ulcers, painful ulcer and painful buboes. In another differentiating feature from syphilis is, here we can have multiple ulcers. Okay, like in syphilis, it is single. Here it is multiple. So you can remember this as chancroid is ID. Like we have tuberculosis, that tells that there are multiple daughter lesions. So remember that even in chancroid ID, it has multiple lesions and it is painful. It can have buboes as well. The incubation period is comparatively shorter as compared to syphilis. It is like 5 to 7 days. It's comparatively shorter in chancroid. What appearance do we see with Haemophilus do cry? Haemophilus do cry is kids cry while going to school. And kids cry while going to school. So there is school of fish appearance that we see with Haemophilus do cry. Okay, there is school of fish appearance is seen with Haemophilus do cry. Okay, so that is what we need to know about chancroid. Multiple and it's painful. Syphilis exudes serum. This synchroid exudes blood. So when we press, it exudes blood. Okay, is that clear with everyone? Next one is LGV and granuloma inguinale. Okay, LGV and granuloma inguinale. So what do we have here is LGV. We said that LGV is caused by L1, L2, L3. That is chlamydia trachomatis. Okay, that is chlamydia trachomatis. And granuloma inguinale, this is called by Calymattobacterium or Klebsiella granulomatis. And a granuloma inguinale is also known as granny is dawn. It is donovenosis. It is donovenosis. Now, LGV starting with L. Remember that it is all about the lymph nodes and the lymphatics. Okay, so imagine that this is all about the lymph nodes and the lymphatic obstruction. So, what do we see in LGV is the lymph nodes. There are buboes which are present, right? There can be no or there can be transient genital ulcer. So, when we have the patient coming to OPD, the patient might not have the ulcer because the ulcer came and just went. Even the patient did not realize, but the patient has buboes. So, this is the one which can present just with lymph nodes without the genital ulcer. So, remember that the buboes are present and there is no or transient genital ulcer. L for lymph nodes, L for lymphatic obstruction. When there is lymphatic obstruction, it leads like filariasis, elephantiasis. So, here also we have genital elephantiasis. Elephantiasis, lymphatic obstruction. So, in the female, the vulval elephantiasis, that is called as ichthyomene, and in the male, the enlargement of the penis, that is called as saxophone penis. Okay, that is called as saxophone penis. So we have ichthyomene and we have saxophone penis that is seen with LGV, right? So remember that the LGV itself helps you remember LGV. It is all about the lymph nodes and the lymphatics, and the GV is like the groove sign which is present. Okay, groove sign is present in LGV. What is a groove sign? So on either side of the inguinal ligament, we have the large lymph nodes. Okay, that is the groove sign. So remember, LGV is the lymph nodes and the groove sign. Okay, and LGV is 3 letters. It has the 3-letter mnemonic. LGV is equal to EFG. What does EFG stand for? It is ichthyomene. Okay, that is the freeze test is stand for LGV, and we have G for groove sign. And so LGV is EFG. So freeze test is stand for LGV, caused by Chlamydia trachomatis. This is the one, remember that, where the ulcer can be absent. It has no or transient genital ulcer. Clear? So that is about the groove sign, the lymph nodes, the lymphatic obstruction, elephantiasis. Now, granuloma inguinale, also called as donovenosis, right? So the next one, that is donovenosis. Donovenosis is dawn, and dawn, right? The dawn, the criminals, they love blood. So blood ke jaisa, this is beefy red ulcer. Okay, the dawn loves the blood, beefy red ulcer. That is the key word for donovenosis. Remember, for donovenosis, all the pseudo signs are seen in donovenosis. Pseudo groove sign, pseudo buboes. These are seen with donovenosis. Donovenosis, dono and spe, there is staining. So this has bipolar staining, right? So when we see in the histopath, it has that bipolar staining. So that is called as Donovan bodies. Okay, Donovan bodies, which has the safety pin appearance or the bipolar staining. So remember, donovenosis is dono and spe. Okay, that is dono and spe. So that is donovenosis. The points that we need to know for donovenosis: beefy red ulcer, pseudo groove sign. It is pseudo groove sign, and it has dono and spe. So Donovan bodies, which has the safety pin appearance. Okay, which has the safety pin appearance. Next we have is HSV, the genital herpes. And herpes, we know that it's very, very painful condition. है ना, जहाँ पे भी herpes होता है. So it is painful, and it can have vesicles as well, right? And these are grouped vesicles. So these are the vesicles which are grouped, and these grouped vesicles, they can join together and they can form a lesion like this, a lesion which has boundaries like this. This is called as polycyclic lesion. Okay, this is called as polycyclic lesion. So grouped painful vesicles is the key word for genital herpes. Okay, that's the key word for genital herpes. Now, going on to the images here, page number 213, let's have a look at these images. So what are we seeing here? The first one, this is the groove sign. Okay, so the first one here, this is the groove sign, and groove sign GV, that is seen with LGV. Okay, that is seen with LGV. What is the next one here? These are the grouped vesicles seen with herpes, right? These are the grouped vesicles, herpes. What is this one here? Saxophone penis, elephantiasis, that is LGV. And that is saxophone penis, elephantiasis. This one is the bipolar staining wala dono and spe. It is Donovan bodies, donovenosis, safety pin appearance. What are we seeing here? This ulcer, the beefy red ulcer, that is donovenosis. It has the beefy red ulcer with the rolled margins. The next image we are seeing here, this is the school of fish appearance. School is kids do cry while going to school. So that is Haemophilus do cry. And I'll come to this one later. This one, the black with the spirochete stone. This is the dark field microscopy, which helps in diagnosis of syphilis. Okay, dark field microscopy, which helps in diagnosis of syphilis. This one here, which is showing the urethral discharge. Right, there is urethral discharge, so urethritis. Gonorrhea is an important differential there. So in gonorrhea, what do we have is profuse, milky discharge. It's a profuse, milky urethral discharge, which is seen with a short incubation period, like within 3 to 5 days. There is profuse, milky discharge. Urethral discharge is what we see, right? So that is gonorrhea. What STI kit do we use for urethral discharge? What STI kit do we use for urethral discharge? STI kit 1, 2, 3, 4. Kौन सा? STI kit 1. And what is the color of that kit? Gray. Kit 1 is gray. And a urethral discharge is gray color STI kit 1. Okay, that is STI kit 1. What do we use for the genital ulcers? What kits are used for genital ulcers? Very good. That's 3, 4, 5. 3, 4, 5 kits are used for a genital ulcer. So for genital ulcers, we have STI kits 3, 4, 5. Okay, that is the 3, 4, 5. Correct. It's the white, the blue, and the red. Okay, and then we have the yellow and the black. So we will next see the topic of STI kits. First, tell me whether this topic is clear with everyone. STI ka topic clear hai? Now you know the important features, the distinguishing features. How will you, how will you basically diagnose a condition? Partners also treating almost everywhere except in herpes, where we don't treat the partner. है ना? What do we need to know about LGV? LGV ka mnemonic is EFG. So LGV 3 letters, mnemonic is 3 letters EFG. Istiomine, freeze test, and it is the groove sign. Trina, that is what I tried to do. Had a complete break for these 4-5 days, and I thought it would be all good, but does not seem so. Groove sign is only in LGV, because those large buboes on either side of the inguinal ligament, those are seen in LGV also. Congenital syphilis. What do we have in congenital syphilis? What is the triad that we see in congenital syphilis? Most important, remember this, it is the Hutchinson's triad. Okay, that's the Hutchinson's triad. And what do we have? What are the components of the Hutchinson's triad? What are the components of the Hutchinson's triad? Hutchinson's triad, we have Bura mat dekho, Bura mat suno, or Bura mat bolo. Right? So Bura mat dekho. So Gandhi ji ke 3 bandar. So Bura mat dekho, related to the eyes, we have interstitial keratitis. Okay, that is interstitial keratitis. Bura mat suno, related to the ears, it is SNHL. Please remember it is SNHL, it's not conductive hearing loss. And Bura mat bolo, related to the mouth, it is the teeth, that is the Hutchinson's teeth. Okay, that is the Hutchinson's teeth. So that is the Hutchinson's triad. Okay, that's the Hutchinson's triad in congenital syphilis. We have regards, right, in congenital syphilis. Another feature is the regards. We have the Wimberger's, the corner sign, bone affected, right? So we have the Wimberger sign that is seen with the congenital syphilis. We said the skin lesions can have vesicles as well. Okay. All right. So that was about the STI. Now going to the STI kits. So the STI kits is page number 132. Okay, page number 132. So this STI kits ka color coding is similar to the color coding of the IV cannula. We have not seen the color coding of IV cannula, right? We have missed that topic. So quickly telling you about the IV cannula color coding. What is the first one that we start with? सबसे नीचे जो हम start करते हैं, below the earth, what do we have? The orange lava, right? The orange lava below the earth. So first is orange. Then above that, we have the earth or the soil, right? Which is gray color. Now what do we have above the gray color? It's a green tree, green plant which is growing. And what color flower do we have on this green jar? Right, that is the pink color. I don't have the pink color, but imagine like this is the pink flower. Now what do we have above the pink flower? First comes the blue sky. Blue sky, then there is the yellow sun. After blue comes the yellow, and after yellow comes the ultraviolet radiation. Okay, that is the ultraviolet radiation. So that is violet color. Okay, that is violet color. So what does that mean is IV cannula नहीं है. IV cannula was there in surgery वाला. बाकी STI kits मैं बताने वाली हूँ. Okay, now so we start with the IV cannula number 14 is orange, then gray is 16, and then you have 18, 20, 22, 24, and 26. Out of that, which one has the maximum? Which one has the maximum flow rate? It is 14. 14 is the one which has the maximum flow rate. It's the opposite. And this is in gauge. 14 gauge, 16 gauge, 18 gauge. Right? 20 gauge is very, very frequently used, right? Commonly in adults. The pink one is 20. इसके बीच में एक odd number वाला है. What do we have the odd number here? Above the earth, above the soil, imagine there is this white fertilizer that we are using. So number 17 comes here, which is the odd number. So white is 17. So it's a fertilizer, the white powder, which we are putting on the soil. So it comes above the soil, that is above the grey color. ग्रीन कलर का फ्लो रेट पूछा गया था INICT एग्जाम में. सो ग्रीन कलर वाले का अप्रोक्सीमेटली फ्लो रेट है 100. ओके, इट्स अप्रोक्सीमेटली 100 व्हिच इज द फ्लो रेट फॉर द ग्रीन कैनुला. Right? Now why did I tell you this IV cannula color coding? Because this STI kids color coding, it's almost similar, right? So first we start with the gray soil, right? So first is gray. Now we have the green plant, okay, the green tree. And now this green tree has the white flowers instead of the pink flowers. Above that, above the plant, the flower, we see the blue sun. And imagine that this is now in the blue sky. The blue sky, now we have entered the space. Now when we have entered the space, so imagine that now we are in the space, we are traveling in the space, and we come across the traffic signal in the space. So it is red, and traffic signal के कैसे कलर होता है? Red, yellow और green नहीं आएगा. You will never get a green signal. Nobody will get a green signal, the go signal in the space, but we will get the black holes. Okay, there are black holes in the space. So what did we learn is, सबसे पहले जो हम start कर रहे हैं नीचे से, that is the gray soil. Above the gray soil is the green plant, right? It's the green plant. What color flowers does the green plant has? It is the white flowers. Now above the tree we have the blue sun. Now blue के बाद space में आ रहा है traffic signal. So first we have red, then we have yellow. Okay, then we have yellow, and but finally we will have the black color. Okay, that is going to be the black color. So gray is the first one, then green is the second one, white is third, then we have blue, which is fourth. Then we have red, yellow, black, which is 5, 6, 7. Is this clear with everyone? Right, so that's a STI kit. So it's gray, green, white, then it's blue, and then it's red, yellow, black. Okay, then it is red, yellow, black. So that is the similarity between the IV cannula color coding and the STI kits. Here we don't start with the orange color. We directly start with the gray color. Now look at this one. So we have gray, green, white, blue, red, yellow, black. Now, what are these STI kits used for? These are like for the syndromic management based on the main symptom, whether the patient has urethral discharge, the patient has genital ulcer, or there are buboes. Based on that, we give the kit for the treatment. So the first one, remember that all the discharges except the vaginal discharge, that is STI kit 1. So first 2 are used for the discharges, right? The next 3 are used for genital ulcer, right? And then we have the lower abdominal pain, and we have the inguinal bubo. So what discharge? Vaginitis, when we write V. Okay, remember that V, again V is second. Okay, V is like 2. So this is for vaginitis, it is STI kit 2, which is green color. Okay, which is green color. The rest of the discharges, be it urethral discharge, be it anorectal discharge, be it cervical discharge, all of these are STI kit 1, that is grey color. Correct? Then we have the genital ulcer disease. Herpetic one is the STI kit 5. So remember this, हमारा 5 वाला हमने mnemonic पहले भी देखा है, हम 5 है ना, हम 5 mnemonic. Where did we see the हम 5 mnemonic? Where did we see the हम 5 mnemonic? Correct, absolutely right. हम 5 is Gunde 6 G6PD. So our HMP pathway is G6PD, which is age limited. हम 5, very good, is also the mnemonic for HLA B5. If you've seen the YouTube video that I've taken on our YouTube channel, so HLA B5 is हम 5. What is हम 5 standing for? Hashimoto's and pernicious anemia. It is HLA B5. Okay. Next one, what we were seeing here. Right, so hum 5. So similarly here herpes wala is 5. So 3 and 4 is non-herpetic. What is the difference between 3 and 4? Now in the 3 and 4, 4 is the one where the patient is allergic to penicillin. Remember, allergic, A is like 4. Many times we have seen Anderson's, glycogen storage disorder type 4. Alport's, collagen type 4. Okay, so this is allergic is 4. Allergic to penicillin, otherwise non-allergic. So syphilis wala hoga. Genital ulcer 3 वाले kit में आएगा. So there will be benzathine penicillin there along with azithromycin for the rest of the genital ulcers. If there is, we said that benzathine penicillin को अगर allergic है, so that is replaced by doxycycline. Okay, azithromycin will be there, and that is the benzathine penicillin is replaced by doxycycline. For herpes, it's going to be acyclovir. Next, we have the lower abdominal pain. So remember the lower abdominal pain, that is yellow. Okay, that is yellow color. Yellow is for the lower abdominal pain, which is seen with PID. Okay, which is seen with PID. Then we have inguinal bubo. Bubo's last one, bubo is black. So black, the last one is the buboes. Now, If I ask you the question, in which STI kit will we have fluconazole? Fluconazole is present in which STI kit? Second, because fluconazole is an antifungal used for candida, right? So it is green color. Okay, so it is going to be green color. Which STI kit will have the injection? Injection will be present in which STI kit? Right, STI kit 3, because it has benzathine penicillin. What is the color of the third one? Gray, green, white. Okay, that is the white kit. Okay, that's the white kit. Next one, which STI kit has 3 drugs? 3 drugs hai usme, but it does not have azithromycin. Yes, that is the yellow kit. That is kit number 6 for the lower abdominal pain. So if you see here, the 6th wala kit, that has cefixime, it has metronidazole, it has doxycycline, but it does not have azithromycin. Azithromycin is present in many of the kits, like you see in STI kit 1, where there is urethral discharge, right? So STI kit 1 mein hai, STI kit 3 mein hai, 4 mein hai, 5 to is antiviral, and STI kit 7 mein bhi hai. So it is present in 1, it is present in 1, 3, 4, 1, 3, 4, and 7. Okay, 1, 3, 4, and 7 is where we have azithromycin. So which kits have azithromycin? It is 1, 3, 4, 7. Right? So azithromycin is present in 1, 3, 4, 7. Correct? So you can just remember this as 1 plus 3 equals to 4, 3 plus 4 equals to 7. Right? So 1 plus 3 equal to 4, 3 plus 4 equal to 7. So 1, 3, 4, 7. Start with azithro. Azithro first. It starts with the STI kit 1. So that is azithromycin. Yeah, this used to be my favorite. Solving these reasoning wale questions, scholarship tests, MTSCs and NTSCs. So, right, that was azithromycin. Next one was acyclovir is present in STI kit 5, which is herpes. Okay, so I hope the topic of STI kits, the color coding and what it is used for is clear with everyone. I don't think you should remember the dosage here exactly. Because there are many other topics in the 19 subjects to be asked. So at least for the NEET PG, you can skip learning the dosages. Just for benzathine penicillin ka dose, syphilis per se is asked. It is 2.4 million units or mega units that is used for syphilis. Okay. All right. And STI kits is done. Remember the color coding, remember for what it is used, and remember just the components at least of the kits. So azithromycin is 1, 3, 4, 7. In a second, what do we have in second then? Second is the vaginal discharge. So we have candida wala, fluconazole, and we have secnidazole. So 2 mein nahi hai. 1, 3, 4, 5, 6 mein nahi hai. 5 mein kya hai fir? 5 is hum 5, it is herpes, so it is acyclovir. 6 mein kya hai? 6 is the yellow, the lower abdominal pain. It has 3 drugs, but it does not have azithromycin. What are the 3 drugs present? Cefixime, metronidazole, and doxycycline. Okay, these are the drugs which are present in STI kit 6. Okay? So, buboes kaun karta hai? The STI kit 7, the black one, the buboes. Right, sir. Absolutely, that is what I was asking. It's LGV and the chancroid. Right, LGV and chancroid. तो chancroid के लिए हम use करेंगे azithro और LGV के लिए हम use करेंगे doxycycline. ठीक है? So that's why there are 2 drugs there for chancroid and LGV. Okay. Hum 5 is kit 5. So hum 5 is herpes. So when I write herpes, okay, when I write herpes, it is like hum 5 wala. So that helps you to remember this is STI kit 5. Yes, Bhakti, we can also remember the blue-white sky, but the only confusion that it can lead to is पहले white है कि पहले blue है. So you need to remember कि पहले थोड़ा white है फिर blue है. So that's why put it as the white flowers. Right. Okay. So that was about the STI kits and the STIs. The next topics that we would be going to is the topics from ortho. Right, orthopedics के topics करने हैं. First one that we have here, page number 216. That is the cast, the splints, and the braces. Okay. So let me just switch off the chart here and start with this topic. So the first one that we see here, right, the first one, I believe I can get a better image, a magnified image. Just give me a minute. Okay, so the first image that we see here, the first one, this is the Kramer wire splint, right? It's like a wire which is crammed up here in the image that we are seeing. So there is a wire which is crammed up, the wire which is crammed up. So remember, this is called as Kramer wire splint. So when do we cram up? When it's an emergency. It's an exam tomorrow, everything needs to be crammed up. It's an emergency. So remember, what do we use in emergency is the Kramer wire splint. Next one, what are we seeing there is the bending of the knuckles. So this is called as knuckle bender splint. Okay, this is called as knuckle bender splint. The bending of the knuckles is the action of the which muscles? The knuckle bending is the action of lumbricals muscle, right? So it is MCP flexion. We remember like the Babaji ka Tullu wala action, MCP flexion, IP extension. So that is the action of the lumbricals muscle, correct? So what do we have here? Knuckle bending, lumbricals muscle. This is used when the lumbricals are gone. That means it is claw hand. Opposite. When the knuckles are not able to bend, they have gone into extension. So it is used in claw hand. Claw hand is ulnar nerve palsy. If we have to choose one, ideally it is both ulnar plus median nerve. Remember from anatomy we have seen this. The nerve supply of lumbricals is ulnar and the median. So knuckle bender splint, if one nerve is asked, it is the ulnar nerve palsy. Okay, ulnar nerve palsy. This image I'm omitting because it's leading to confusion. So I'll show you in the next slide the better image of that. Okay. So next one, this is the aeroplane splint. Okay, aeroplane splint. So imagine the aeroplane, paper ka aeroplane bana ke we used to fly. We do it with the hand, the upper limb. So remember the aeroplane is the upper limb supplied by the brachial plexus. So that is brachial plexus injury. Okay, that is brachial plexus injury. Next one that we have, this is the Thomas splint. Okay, that's the Thomas splint. Thomas splint, TH for TH. Remember Thomas splint is used for thigh. Okay, Thomas splint is used for thigh. So shown in this image here, this is how the Thomas splint is used. It has a ring and it is used like this. It's used for femur fracture. Thigh matlab femur bone. It's used for the femur fracture. It has a ring. It has this angulation to accommodate the greater trochanter. Next one, what are we seeing here? The foot we are trying to raise, the toes we are trying to raise. So this is the toe raising or the foot raising splint. When will we use that? When the foot is dropped. The foot is not able to go up. So this is used in foot drop. Okay, this is used in foot drop, the toe raising splint. What leads to foot drop? It's the common peroneal nerve injury. Common peroneal nerve injury injury happens in which fracture? It is the fracture fibular neck, right? So the proximal fibular fracture that affects the common peroneal nerve that leads to foot drop. This one, we can see that these are the shoes. So shoes are going to be used, of course, for the foot wala condition. That is CTEV. Foot wala condition is the CTEV. Now, what is the name of the splint? This person who's sitting in this position, the abnormal position here, this name of the person is, remember, this is Dennis Brown. So for CTEV, we use the Dennis Brown splint. Okay, we use the Dennis Brown splint for CTEV. This one here, where we have 3 pulleys, 1, 2, and 3. So remember the 3 pulleys, I join it, it becomes B. So this is BB splint. That is the Bowler-Brown splint. Okay, that is the Bowler-Brown splint. Remember 3 wala is the BB wala Bowler-Brown splint, which is again used for fracture femur. Okay, which is used for fracture femur. The 3 pulleys are used for the 3 parts of the lower limb. That is, one is for the thigh, one is for the leg, and one is for the foot. Okay, the thigh, the leg, and the foot. Uske liye 3 pulleys hote hain. So Bowler-Brown again is for the femur, the thigh. Next one that we have here, all these images that we are seeing, you can see the position of the thigh. It is the abducted position. In all of them, the position is the abducted position for a reason. Why are we using the abducted position here? Because this is a patient of DDH or CDH, where in the abducted position, the femur head relocates. Okay, the femur head relocates into the acetabulum. So we need to keep the thigh in the abducted position. Right, we have the test also for DDH. What are those tests? The Barlow's test and the Otto-Lani's test. Barlow's and Otto-Lani's. How do we remember what is Barlow's and what is Otto-Lani's? Barlow is like bahar lo. Kisko bahar lo? Femur head ko bahar lo. What takes the femur head out of the acetabulum? That means it gets dislocated. It is adduction. So in Barlow's, it is the adduction that is used. The thigh is adducted. So remember Barlow and Bad. So in Barlow's, it is adducted. So you can remember that in adduction, the femur head goes out. Otto-Lani is like Andarlani, get the femur head in, and that is in the abducted position. Okay, that is in the abducted position. So here we use the abducted position to relocate the femur head. The various splints that we are seeing here. First one, which has the straight band connecting the 2 thighs. It's a straight band connecting the 2 thighs. Give me a minute. Right. So we were discussing about the DDH. So when we see this straight band, so remember it's snakes also we are seeing. Straight is crate, right? The one, the snake which has a straight band is the crate. So similarly here straight band, straight is not crate but the Craig here. Okay, so this is, there it was crate, here it is Craig. Okay, that is Craig. This one, when you see this V वाला, similar to वो snake में देखा था, सीधा V, उल्टा V. So ये वाला जो है यहाँ पे V सीधा, V उल्टा जो ऐसे बना रहा है with the abducted thigh. There it was diamond shape. V for viper, here V for Von Rosens. Okay, that is Von Rosen. And then we have the next one where the baby is in a harness. Like the baby is harnessed, completely packed, even the feet are packed. So this is a harness. The public harness is what is this used for DDH. Okay, so these are the various ones for DDH. Next one is now coming to the spine. Okay, the various splints used in spine. The first one that we see here, these are the like 4 posts. This is 1, 2, 3, 4. So starting from here, 1, 2, 3, 4. This is a 4-post collar. Okay, this is a 4-post collar used for cervical immobilization, right? Neck ko immobilize karne ke liye. The next one here, this is a sumo fight that we are seeing. So this sumo is okay. Again, give me a minute to get the magnified image of this one. Right. So this one, you can see the sumo here is holding the neck. Okay, so remember the sumo is holding the neck. So sumo or somi brace. Okay, so this one, the second one, this is the somi brace, is used again for the neck. Sumo holding the neck, it is for the cervical immobilization. What does somi stand for? Sterno-occipito-mandibular immobilization. It is sterno-occipito. So sternum-occiput-mandibular immobilization. That is what we are seeing in this image. So we have the sternum, पीछे ऑक्सीपुट किया जा रहा है और मैंडिबल किया जा रहा है. So we have sterno-occipito-mandibular immobilization. That is the somi brace, which is used for neck. Okay, the cervical immobilization again. This one, which we see here, this is like an off-shoulder dress, right? The off-shoulder dress. So imagine the beautiful girls in Boston. They wear this off-shoulder dress. So Boston brace is the off-shoulder. And what is it used for? This is used for scoliosis. Okay, this is for the spine. This is used for scoliosis. What is this one here? Again used for scoliosis. The one which you see that anteriorly and posteriorly it's going from above to below. So anterior is also going ऊपर से पूरा नीचे तक. There is this पूरा band. And posteriorly also you see that ऊपर से पूरा नीचे तक there is a band. So this is Milwaukee brace. Okay, this is important. The spine wale are very frequently asked. So Milwaukee, so it's like Milwaukee, the 2 ends at both sides, the anterior also and posterior also. So that is the Milwaukee. It is Milwaukee, that is Milwaukeeing the 2 ends ऊपर से नीचे तक, आगे भी और पीछे भी. That is Milwaukee. So Milwaukee is also used for scoliosis. Okay, Milwaukee is also used for scoliosis. The next one that we have, this is Ash and this is Taylor brace. Taylor Swift, right? Not a Taylor brace. This is Ash and Taylor Swift. So look at both of them. They are standing with their hands on the kamar. So this is to remember that these Ash and Taylor, these are used for dorso-lumbar immobilization, right? It is for not for the cervical immobilization. It is this dorso-lumbar immobilization के लिए use करते हैं the Ash brace and the Taylor brace. How do we identify the Ash? This is the Ash brace. Ash is anterior spinal hyperextension. So you would just see the brace which is present anterior, आगे की तरफ dorso-lumbar immobilization. So एक band होगा which is trying to immobilize the dorso-lumbar region. So it's only anterior. This one is the Taylor brace. Okay, this one is the Taylor brace. Taylor brace, imagine a tailor wearing a dress with the suspenders. Tailor wearing a dress with suspenders. So you would see these suspenders sort of thing coming from the shoulders and kamar pe ye patta rahega for the dorso-lumbar immobilization. So when you see the suspenders like this, that is the Taylor brace. So this image also here, when you see the suspenders with this immobilization ke liye, this is the Taylor brace. Okay, that's the Taylor brace. So what did we see here? 4-post collar, somi, Boston, off-shoulder, Milwaukee, आगे पीछे ऊपर से नीचे तक. We have the Ash and we have the Taylor. Okay, we have the Ash and the Taylor. Ash is anterior spinal, Taylor is with the suspenders. Okay, Taylor is with the suspender. Next one that we see here, this one, the first one is the glass holding position that is shown here. So this is the glass holding cast which is used for scaphoid fracture. Okay, that is used for scaphoid fracture. So that is the glass holding position. The thumb is also included. But remember that it's not necessary that always the thumb would be included in the cast for the scaphoid fracture. ठीक है, ऐसा जरूरी नहीं है कि हमेशा thumb include हो गई. So this is glass holding, that is for the scaphoid fracture. Important points for scaphoid fracture. Scaphoid fracture, there is predisposition to AVN, right? There is predisposition to avascular necrosis. We need to take special X-ray views, the oblique views to look for the scaphoid fracture. This will cause the anatomical snuff box tenderness. Okay, that will cause anatomical snuff box tenderness. So this has been asked in one of the recent exam. So scaphoid, she looks too pretty. The carpal bone arrangement, scaphoid is towards the radius, towards the thumb. So anatomical snuff box is scaphoid fracture, glass holding cast. Next one, when you see that, this is like the handshake position. This is handshake wala position. In handshake, what do we have? Imagine the handshake is like this. So there is ulnar deviation, and the handshake is like this, the palmar flexion. And this is used for Colles fracture. So what do we have in a Colles fracture? What displacement? A, B, C, D. Colles has dorsal displacement. So dorsal displacement को neutralize करने के लिए, we do the Colles cast is put in the palmar flexion. So the cast is put in palmar flexion. In Colles, there is radial deviation, so we put the cast in ulnar deviation. Okay, the cast is put in ulnar deviation. So palmar flexion, ulnar deviation is what we have. So the image below that is showing the steps of putting the Colles cast, right? There is traction, and we have the ulnar deviation and the palmar flexion that is done for the Colles. Okay, this is the Colles cast, which is handshake. Okay, that is handshake. This one here, this is the dynamic, the counter traction brace. Okay, this is the counter traction brace which is used for the tennis elbow or the golfer's elbow. This is used for tennis or the golfer's elbow. So what happens? What is tennis elbow and what is a golfer's elbow? So what is tennis elbow and what is golfer's? Tennis, remember tennis is lateral. So when I write lateral, tennis elbow is the lateral epicondyle, which is the common extensor origin. So it affects the common extensor origin, lateral epicondyle. What test do we do for tennis elbow? Remember playing tennis with cousins. Okay, playing tennis with cousins. So that is the Cousins test. Okay, that is Cousins test. Golfers becomes the medial epicondyle, that is the common flexor origin. Okay, so this test that we are seeing here, what is the movement that the patient is doing? It is the extension. Okay, that is the extension that is done. Looking for the tenderness here at the lateral epicondyle. This is the Cousins test, which is done for tennis elbow. Okay, this is the Cousins test, which is done for tennis elbow, right? And this is the counter traction brace, which is basically giving the counter traction so that the muscles do not get pulled off from the common extensor or the common flexor origin. So it's trying to prevent the muscle pull from that bone. So that is the dynamic counter traction brace that is used for tennis elbow and the golfer's elbow, right? So that was about the various splints, the cast and the braces. We have that table. Let us quickly see this table. So Kramer wire splint, we cramp in emergency. So Kramer wire is emergency. Thomas is that ring wala, right? ऐसा था Thomas splint, thigh के लिए, femur के लिए. Bowler bra was that 3 pulleys used for fracture femur. Aluminium splint, छोटा सा splint for the fingers. Dennis Brown, वो foot wala position, CTEV. Cock up splint. Remember the cock up splint is used for radial nerve palsy. Did we not have the image of cock up splint? हमने एक यहाँ पे miss किया. Okay. So this one here, image 129.5, where we are taking the wrist up. That is the cock up splint. So cock up splint, we are taking the wrist up. This is used in wrist drop. Wrist drop. Remember the wrist drop? That was radial nerve palsy. Okay, that was radial nerve palsy. So cock up splint is used in wrist drop. That is radial nerve palsy. Knuckle bender is the ulnar nerve palsy. Claw hand. Toe raising is foot drop. The common peroneal nerve. Volkmann splint is Volkmann's ischemic contracture. 4-post collar was the neck immobilization. Aeroplane was the brachial plexus. Okay, aeroplane was the brachial plexus. Somi is the neck wala, cervical spine. Ash and Taylor is dorsolateral immobilization. Milwaukee, Boston is scoliosis, right? Milwaukee ऊपर से नीचे, आगे पीछे, and Boston is the off-shoulder one, and lumbar corset is the routine one. The belt is the lumbar corset. Okay, the belt is the lumbar corset. ठीक है? So everybody is clear with the splints, the cast, and the braces. The angle in the Thomas is used to accommodate the greater trochanter. It's an angle of 120 degrees that we have. That it's used to accommodate. It is present to accommodate the greater trochanter of femur. So do you still have this doubt here regarding the test for DDH? Let me try to get the image of that. So look at this one. This is the image A which is labeled, and this is the image B. What do you think this image A? Is it the Barlow's test or is it the Otolani's test? Correct. Absolutely right. The first one, the image A is the Barlow's. This one is the otolanis. Because what I'm seeing with the bar lows, what is happening is the femur is getting dislocated. It is bahar low. The femur यहाँ पे है अंदर, फिर हमने उसको जब adduct किया, right? We are doing the adduction. So bad. Okay, that is bad. So in bar lows, it is adduction that is leading to the femur dislocation. That is bahar low. Here we are doing abduction. Okay, that is abduction. Remember the splints of the DDH, they are put in the abducted position. That takes the femur in. So it is under knee. Okay, so remember that it is otolani अंदर लेके जाता है adduction. Yes, very good, Bharat. We can remember like that also. कि bar, if you go to bar again and again, it can lead to adduction. Bar का adduction. Yes, good. Otolanis is out. But इसमें confusion ये होगा कि out is the abduction or the out is the femur going out. So you can remember that bar is adduction and it is bar low. That is bahar low. है ना? Von Rosen and Milwaukee are very, very different, right? Von Rosen we saw is that V wala, है ना? Or the thigh in the abducted position. That for DDH. Milwaukee is for the scoliosis. ऊपर से नीचे तक spine का रहेगा, right? So Milwaukee will be पूरा, right? ऊपर से नीचे रहेगा. And Von Rosen's is very different. So Von Rosen's आपको यहाँ पे Von Rosen's ऊपर से नीचे या spine में नहीं दिख रहा है. The thigh is in the abducted position, right? So these are very different. The Von Rosen's and the Milwaukee's. Milwaukee's is used for scoliosis. It's for the spine, right? So it's used for scoliosis. इसमें foot का cover है. Harness में the foot is also included, right? ये पूरा harness में the foot will also be covered. Remember, harness is like the baby is harnessed, the baby is captured, including the foot in the harness. Okay. Right. So that was about the cast, the splints, and the braces. Do try to solve questions on these. Okay, very, very important. Do try to solve the questions on all of these. Next topic, let's quickly do the metabolic bone disorders, which we have done in the recent NF100 topic as well. And I hope all of you have attended that. How many of you have seen the NF100 where we did the lab values in the bone disorders? How many of you have seen that? So that I get to know the numbers. And for those who have not seen, yeah, you can give the other emoji there. Not seen, why don't you see the NF100 episodes as well? They are very, very important. Majority are like, nahi dekha. Okay, so let's try to quickly simplify this. For those who have seen the NF100, you can skip this. Okay, it's a topic that has been covered in the recent NF100 as well. So metabolic bone disorders. Quick points about how to remember this. First, which is that bone disorder where it is all normal. That means it is calcium, phosphorus, alkaline phosphatase. Everything is normal. That is osteoporosis. Okay, it is osteoporosis. So where the bone mass is decreased. So everything is normal, right? It's a bone mass which is decreased. It's not a metabolic problem. So calcium, phosphorus, alkaline phosphatase, everything is normal, is osteoporosis. Next, how do you differentiate Paget's and multiple myeloma? Paget's versus multiple myeloma. Remember, for the lab values, these are the opposite. What is the opposite? In Paget's, the only marker which is increased is, what is the only marker which is increased in Paget's? It is ALP. So only alkaline phosphatase is increased in Paget's. So that means the calcium, the phosphorus is normal. While in multiple myeloma, it is only like the alkaline phosphatase which is normal. It's the opposite. Why? Because alkaline phosphatase is a marker of new bone formation. And in multiple myeloma, there is no new bone formation, right? Multiple myeloma is about the lytic lesions in the bone. So only alkaline phosphatase is normal, calcium, phosphorus is increased. Remember that that's the reason that in bone scan, what does multiple myeloma give in the bone scan? A hot spot or a cold spot? What does it give? It gives a cold spot. Very, very important. Multiple myeloma gives a cold spot on the bone scan because there is no new bone formation. Okay, there's no new bone formation. Next is about vitamin D and the parathyroid disorders. Vitamin D controls calcium phosphorus. Parathyroid also controls calcium phosphorus. Remember that parathyroid hormone, OPT-PTH, it has the opposite actions on the calcium and the phosphorus. It increases calcium but decreases phosphorus. Okay, so remember that parathyroid catches calcium. That means it increases calcium. Catches calcium, it tries to increase the calcium. So opposite effect on phosphorus. Vitamin D, D for dono pe same effect. It increases calcium, it increases phosphorus. It does the same effect. It increases both. Okay, it increases both. So when you have the opposite effects on the calcium and phosphorus, you should think about it's a parathyroid disorder. When both the calcium and phosphorus are going in the same direction, both increasing, both decreasing, you should think about it's a vitamin D wala problem. Okay, it's a vitamin D wala problem. Now, what is the difference in various types of hyperparathyroidism? Primary, secondary, tertiary. Primary hyperparathyroid means the primary problem is in the parathyroid itself, like parathyroid, hyperplasia, parathyroid, adenoma. So the primary problem, the primary is the increase in the parathyroid, and that leads to the effects. That is, catches calcium and the phosphorus decreases. Secondary hyperparathyroid means the parathyroid is increasing because of some other cause. It's not a cause in the parathyroid. So secondary का common cause है renal failure, which stimulates the parathyroid hormone. Why will the renal failure? So vitamin D, if it is decreasing, the calcium will decrease, the phosphorus will decrease. If there is vitamin D toxicity, the calcium will increase, the phosphorus will increase. It goes in the same direction. So vitamin D increases both, decreases both. Okay. So renal failure, why does it stimulate the parathyroid? Is because of NF100 YouTube. Okay, it was a YouTube session. I keep you posted about everything, all the sessions on the Telegram group. So stay connected there. Renal failure, the calcium decreases. Why does the calcium decrease? One point, because there is no vitamin D. Why renal failure will affect the vitamin D levels? Because the 1-alpha hydroxylation of vitamin D takes place in the kidney. So the active form of vitamin D is not formed. So no vitamin D, no calcium. So the decrease in calcium tries to stimulate the parathyroid to increase the calcium levels, right? We want to increase the calcium levels. Vitamin D नहीं कर रहा है तो parathyroid से करवाएंगे. So that is why the primary change is the decrease in calcium, which is increasing the parathyroid. So what will be the phosphate levels? Calcium decrease हो रहा है तो phosphate बढ़ेगा. This is again because of the renal failure. The phosphate excretion is not happening. So remember that it's the opposite. Tertiary hyperparathyroidism. Tertiary में what happened? So in tertiary hyperparathyroidism, remember tertiary is like autonomous. Everybody wants to be dominant. So everything is increased. Calcium increases, phosphate increases, parathyroid increases, every alkaline phosphatase increases, everything increases in tertiary hyperparathyroidism. All increases. Okay? So let's have a look at this table at page number 225. The first one, rickets or osteomalacia, which is vitamin D decreasing. So calcium also decreases and the phosphate also decreases. They both go in the same direction. Right? Hyperparathyroidism primary. So the primary cause is the increase in parathyroid, which increases the calcium, which decreases the phosphate. It is opposite. Okay, it's opposite. Secondary में, the primary change is the decrease in calcium, which increases the parathyroid, and there is increase in phosphate. Tertiary, everything dominant, all increases. Osteoporosis, very, very important, it is all normal. Paget's disease, everything is normal except the ALP, which is increased. So in Paget's, only the ALP is increased. In osteopetrosis is another condition where it can be all normal. One is osteoporosis, one is osteopetrosis. Vitamin D deficiency, right, can lead to secondary hyperparathyroidism because of the hypocalcemia. It's similar to the renal failure basically. Right. So see, whenever you have hypocalcemia, right, if there is hypocalcemia, the two possibilities we can think about कि ये vitamin D deficiency के वजह से है या फिर एक हो सकता है कि ये बाद में करें secondary hyperparathyroidism. The difference will be if it is vitamin D deficiency hypocalcemia, even the phosphate will decrease. If it is secondary hyperparathyroidism, renal failure wala, here the phosphate will increase. Okay, here the phosphate will increase. Right? So hyperparathyroidism, vitamin D deficiency, by the decrease in calcium, it can stimulate the parathyroid hormone as well. But agar this is the primary cause of the increased parathyroid, the phosphate will also decrease. Here the phosphate increases because of the renal failure, right? The kidney is not able to excrete the phosphate. So the phosphate increases in the secondary hyperparathyroidism. Here the phosphate decreases because the primary is the decrease in the vitamin D deficiency. Right? So remember that vitamin D same, दोनों same direction में जाएंगे calcium phosphorus. Parathyroid opposite में जाएंगे except in the tertiary one. In the tertiary one, everything will increase, and you can see that alkaline phosphatase is increased in all of them except the multiple myeloma, osteoporosis. The alkaline phosphatase is normal. Alkaline phosphatase हर जगह बढ़ता है. ठीक है? Is this clear with everyone? The metabolic bone disorders. All you need to do is just try to solve some MCQs on that. What are the normal values of calcium? Normal is like 9 to 11. Phosphorus का normal is potassium के जैसा याद रखना 2 to 4 के आसपास is a normal phosphate. Alkaline phosphatase more than 130 is high. Alkaline phosphatase more than 130 is high. ठीक है? Osteopetrosis में also it can be all normal. Like osteoporosis, it's a marble bone disease, right? Osteopetrosis, so it can be all normal. Multiple myeloma gives a cold spot. So in bone scan, it's a new bone formation which gives a hot spot, right? So fracture, where there is callus formation, osteomyelitis, where there is periosteal reaction, osteoblastic metastasis, all these give the hot spot. In multiple myeloma, there is no new bone formation, and that is why it gives a cold spot. क्योंकि वहाँ पे new bone formation नहीं हो रहा है. So whatever does not have a new bone formation will not have a cold spot. Okay. Multiple myeloma skull will be the punched out lytic lesions, the raindrop lesions. Paget's will have the cortex will be thickened, right? There would be the cotton wool skull. There can be osteoporosis circumscripta. That is what we would see in Paget's skull. Right? Cotton wool, क्योंकि उसमें elastic phase भी होता है ना Paget's में. So cotton wool भी होगा, lytic भी होता है, osteoporosis circumscripta भी होगा. In multiple myeloma, it's only going to be the lytic lesions. ठीक है, rickets का types I'm not covering here. Sorry for that, Dr. Srinivas. So that was for today, guys, and thankfully we could do the 1.5 hour session. NF100, you will get all the links on the Telegram channel. Just search NF100 sessions. You will get all the links. Majority of the sessions are on YouTube. Some sessions are on Unacademy free classes, so they are available on both. Okay? Rickets and scurvy X-ray standing up. Do watch. Just search on YouTube rickets scurvy Dr. Nikita. So on my YouTube channel, you will find a very good video summarizing the difference between the two, the rickets and the scurvy. So yeah, daily we have the class at 8. So thank you so much, everyone, and I would see you again at 11 a.m. for the radiology test and discussion, which is on the plus. And if time permits, and more so if throat permits, I will try to add an extra session for short 150 today, depending on what happens, what my throat says. So based on that, okay? So thank you so much, everyone. Goodbye. Take care, and keep studying, keep revising, and keep winning, and have a great productive day. Thank you.